Good evening, everyone. I'd like to welcome you to the Town of Pownell Special Select Board Meeting, December 18th, 2025 at 6 p.m. I'd like to call the meeting to order. Could we all rise for the Pledge of Allegiance, please? I pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Board member roll call.
Strohmeyer.
Sheeny Alexander.
Mike Gardner.
Amy Percy.
First item on the agenda is Pownell Rescue Squad appropriation increase request presentation, discussion, and possible action. So the rescue squad has asked for an increase in their appropriation from, and correct me if I'm wrong, from $150,000 to $300,000. Is that correct, Beck? Okay. So I'll open it up to members of the squad for their presentation.
You all want to say. Go for it. No, if you both hear you, they'll be able to see you better. And hear you. So, yeah.
And would you just state your name, please, before, just so people know who's talking? That's all.
So, well, you all know Becky. My name is Paul Pangburn. I'm a driver for the Pownell Rescue Squad by night. By day, I'm trained in healthcare administration. So Becky has asked me to come and help her make this presentation to the board here today. So we'll get started. The next slide. This is just by way of context, what our year has looked like so far. At a high level, I think we're maybe on track for somewhere fewer than 900 calls this year. That's certainly lower than we've seen in years past. I think as recently as 3 years ago, our call volume was over 1,000. And as much as maybe we don't like it to be this way, running any healthcare business is a business. And so this poses a pretty substantial revenue challenge for us. And it's bittersweet in a lot of ways. We're not seeing the call volume because means people aren't calling 911, which means they're not having emergencies. That's all great, right? I think, be very glad to have people not use our service. But at the end of the day, we are running a business and have to make plans accordingly. So to kind of combat some of these revenue shortfalls that we've had so far in 2025, we've done a couple new things. Let's see here. One of them is that we'll start having mutual aid reimbursement when we respond outside of the town of Pownell. I think our two most common places we go are Bennington and Williamstown. I think it's, if I can be correct if I'm wrong, it's a mutual agreement where if they respond mutual aid to our jurisdiction, we'll pay them. And if we respond mutual aid to their jurisdiction, they pay us. Again, Becky, please correct me if I'm wrong. I think in the last year, I don't think we've gone or accepted mutual aid from any agency to respond in the town of Pownell.
Six. And all because we were on other calls or needed multiple aid.
So the overwhelming most common thing that happens is we're responding outside of Pownell. So we expect that to, I mean, it's going to move the needle, probably not very much, but every bit helps, and we'll see in a couple of slides kind of why we think that's going to be important. And then the other big thing that we're doing is we have a transit contract with SPMC 2 nights a week. What we do is provide a dedicated crew to help move patients out of the ER to other tertiary care facilities. Generally speaking, we go to Albany or Dartmouth. But that's kind of nice because as opposed to 911 where people can refuse, we know that we're going, when we do a transfer like that, we're accepting payment for that. So that's not something that's helpful on the revenue side as well. The bottom, but at the end of the day, right? These things are substitutes for or help substitute our revenue. But at the end of the day, you can see our transfers are 12% of what we do. The overwhelming majority is 911. And so when 911 volume is down, our revenue decreases as proportion of that. So that's why we're here today. This is a problem that is facing every EMS agency across the state. In fact, it's on Friday, there was a report released by legislature. It was a committee that had studied the state of EMS in the country or in the state. And what they found was that every agency, is facing this revenue shortfall that is in part a function of call volume and in part a function of the way insurance reimbursement works. And we'll talk a little bit more about that as we get into this. But this is not a unique problem. This is not a Pownell rescue specific problem. It's not a town of Pownell problem. It's a statewide problem. And we're asking the town of Pownell to help us mitigate that. So we can go to the next slide. So this is where we're at now. There's a lot going on here. This is the kind of a simplified version of where we are this year. On the leftmost side, you see our total net income. Again, the overwhelming majority of that comes from insurance deposits, which is overwhelmingly our 911 calls. We get a certain amount of guaranteed revenue from our SVMC transfer contract. That's the other line item. And then we've had some very generous donations from the community here. Of course, we're grateful for that. I removed from this the contributions that we've already received from the town of Pownell because that's it's not earned revenue, right? What I'm trying to highlight here is our operational shortfall. And so what we're asking for is the town to help us bridge this gap. When you look over at our total net expenses, you see, again, this isn't surprising for an agency that is having people present. Our most common expense is payroll. We'll break that down a little bit more, but what we get for that payroll is one crew. Generally speaking, it's advanced life support, 24 hours a day, 7 days a week, 365 days a year. And then there's a little bit more on top of that for the SVMC transfer contract, but the SVMC is the one paying the cost of labor for that effectively. That's the way it works out. So generally speaking, our payroll expenses are based on the 911 coverage that we have within the town. Let me just make sure I made all my points here.
So I have a quick question, not to interrupt you, but while we're right here. So the income on the left, the insurance deposits, the transfer, and the donations, you said that does not include the revenue from the town, from the town budget. Is that the ones on the left, right?
Yes, that's correct.
Okay.
Yes.
And that's 365, 752 on the left. I'm trying to see it.
There's some, I don't want to say a fudge factor here, but this is not, audited financial statements.
Well,
It's not, we're in the ballpark.
Right, okay. I want you to know that when I'm doing the math right here, I'm not breaking it down to the penny, okay, we're just round numbers, okay? So, right, when you're talking that kind of money, we don't need to break it down to the absolute dollar right now.
Mhm.
So just so you know where I'm coming from, okay?
Yep. Another question?
I was just looking at the 50,000. Would this be before when it was a ballot article?
No, this is the
This,
20,000 we've already
That you
received.
received, so you have another,
So
right?
Yes, I removed it. So we got that on November 1st. And so I took that out because that's really part of our 2026 revenue.
Yeah.
And so again, the point of this was to highlight the operational shortfall that we have in 2025.
And the expenses are what, 550?
But in parentheses.
A question,
Yes.
what is the lag time between the call and reimbursement?
Anywhere from 30 to 90 days, if it doesn't need to be appealed. So like Medicare, Medicaid is typically I think it's like 19 to 30-day turnaround. If everything doesn't, if we don't need to correct anything, billing paperwork and commercial payers are a little longer, anything like workman's comp, motor vehicles, those all related to be fought between insurance companies, so those are all.
So, questions. If we can, we'll try to hold them. I think that was a legitimate question, Carl, but I don't want to get into because you guys have a presentation, okay? So I know we had a couple of questions right there. I just don't want to get into a whole back and forth. No, that's fine. If something that pertains to a slide, I don't have a problem with it, right? Because we don't want to forget it, okay? That's why I'm making a shit ton of.
Yeah, and so the other point that we'll make here is that we're pretty much powerless to affect the rate at which we're reimbursed for our services, right? It's a contracted amount from the insurance company. We send them the claim, they tell us how much they pay, that's the end of it. We have a billing partner that we use for that. They're pretty good. They're better than most, but it's, again, we get what we get and that's that. And on average, you can see that this is the point, is that what we actually collect is about 70% of what we bill. And so if you take that number, that 365 number, and divide it by, increase it by 30%, right? We're closer, we're a lot closer than we would be right now. There is nothing we can do about that, right? We get what we get. That's the bottom line. We would love for the state to intervene and allow for higher reimbursement for Medicaid. We'd love for the federal government to allow a higher reimbursement for Medicare. Those are our two most common payers, and they're the worst offenders at not paying close to what we bill. Commercial insurance is a little better. Private pays the best from a collections perspective. But in the community, most of the people that we see, or most of the people that we transport are on some form of public insurance. So, again, this is a well-known problem in the industry. It's very common in Vermont. It's a fight that's probably happening right now in the legislature. It happens every year. If that changes, it's a much different picture, but it's not likely to change. We know it's not changing in 2026. It's not likely to change in the future either. We can go to the next slide. So this is how we've done it, right? Again, we're on track to lose somewhere around $250,000 this year when it's all said and done. We've had, historically speaking, better years. Like I said, you go back as recently as 2 or 3 years. We have much higher call volume. The business model as we have it, when call volume is higher, works. We're able to collect enough to cover our expenses. This year, like I said, it's a double-edged sword. We're happy and sad about it, just not the way that it is. So the operational loss that we've had, not just this year, but you go back last year, probably even the year before that, has been offset by transfers from our reserves. And at this point, it's just a math problem, right? You can see what we have on hand, roughly speaking, right now. What we will get, and to be clear, that includes the $50,000 that we've already got in November from the town. What we'll get in 2026 for the total, and then if nothing changes in 2026, we've got about 9 months. Gets us to September of 2026 before we're faced with some difficult decisions about what comes next. And we'll talk about that in a couple slides here. But there's kind of 2 other pieces to this. We do what we can to mitigate expenses. I think the big one is that we have people that volunteer. I volunteer my time. Becky and Danielle volunteer some time. Brian as well, who also volunteers time. We're not that big a crew. I think there's 11, 12 people that work now. 13. A lot of us volunteer our time for the benefit of the community, and we're happy to do it. But the reality is that doesn't trickle through to payroll, right? That 15% of man hours since October, that doesn't reflect in our payroll expense. So ideally, everybody gets paid for the time they work. And so our payroll expense should be, generally speaking, 15% higher than it is. On top of that, we pay 20% less than other agencies. Every one of our providers could go right up the road to Bennington, get a 20% pay raise today, right? They're looking for people. So the fact that they don't, what was that? With benefits, yes, which we don't offer. So the fact that they don't is a testament to their commitment to the community. And so this is all just a long-winded way of saying that Colorado Rescue plays an important part in serving this community, and it does so for a pretty good deal. Through factors outside of our control, reimbursement just isn't where it needs to be. And that's why we're asking the town to step in and make up the revenue shortfall that we don't have. We can go to the next slide. I wish I had a more rosy outlook on 2026. I don't, unfortunately. Our best case scenario is that, from a revenue perspective, is that call volume increases. Again, it's not lost on me. When people call 911 more, that means things are going wrong. That means people are sick. Of course, not what we want from health of our community and a health of the community perspective, but that's kind of where we're at with it. There is, we've done what we can to trim the fat. At this point, we'd be cutting the bone to trim anymore. You can see the list of kind of some of the things that we've done. We're within the bounds of what is safe for us to do in terms of delaying equipment replacements, that kind of thing. We've done what we can. And the other piece of that is what we're asking for is to close the gap in our operations. We still aren't able, even if we did that, we're still not able to plan for the future. We have an aging ambulance right now in PR1 that within the next 3 years is probably going to need to be replaced. We have some other aging monitors, some other types of equipment. that are unfortunately very expensive and will also need to be replaced. You know, I think the kind of overarching sentiment here is that while we've done what we can, something needs to be done today to help us close that gap, to ensure that we have enough time to make a better plan for these more expensive things that are on the horizon. So, you know, and again, this is just a math problem, right? We don't have unlimited cash of our own to draw from. I guess that's the bottom line. Can indefinitely fund Power Rescue's operation through cash reserves. There will come a time where we can't do that. That might be in 2026. And we're hoping to get to 2027 and then beyond. But for the time being, there's kind of where we're at. So on the next slide, we'll see kind of what the alternative is, because that's really what we're facing is Pownell Rescue as an operation. If we were to stop existing or just not be here, we're not here. They were not here anymore. What happens? Well, you still need EMS coverage in the town, and it would come from one of two places. It's either a local agency like Bennington or Williamstown. And I should preface this by saying we haven't had conversations with any of these agencies about what that would look like. So this is purely theoretical or for the thought process. So it would be Bennington or Williamstown probably, or a private contractor like Mohawk or Ambulance. They operate a lot in the Capital District right now. We found a contract for the town of Brunswick. We could send that around if you are interested, but it's available online. It's from 2023 for a BLS ambulance in and covering the town. They're granted, they're a little bit bigger than us, but just for sake of comparison, they're paying $1.6 million per year. Again, the coverage we provide is ALS, so we provide a higher level of coverage, certainly at a lower cost than a private contractor. Then the other issue is that if we turn to a local rescue squad like Bennington or Williamstown, they're not going to do it for free. And it would really depend kind of on the setup. But again, Bennington Station is in Bennington, Williamstown is in Williamstown. Well, it's a 20-minute drive, no matter how you cut it. So oftentimes, in emergency situations, time is of the essence, right? The faster you get there, the better the outcome is. There is a lot of reason to have local coverage beyond just retaining local control. But from a health perspective, you have a better chance of achieving better health outcomes for the people that we serve if we're here locally. And then that's on top of the fact that it's probably just cheaper to do it locally. So we go to the next slide. This is kind of where we're at. You know, the support that we already receive is great, and we wouldn't be here today having this conversation if it weren't for that support. The reason why we're here today is because we want to continue as part of the town, continue serving the people that live here, but you know, ringing the alarm bell that, you know, time is of the essence, right? We face a pretty dire set of circumstances that are support from outside of what we can get ourselves. Yeah. No.
Okay, so.
Question.
Oh, no, go ahead, Mike.
June?
Yes, you can help me out with a couple of things here. So you said that it sounds like the mutual aid reimbursement will be increasing from primarily Bennington and Williamstown. So I guess a couple of questions in conjunction with that. And I know that we've talked about this before, but if you could refresh my memory, about what percentage of the calls are outside the boundaries of Pownell? So for Williamstown or Bennington or across the line in New York, for which we could anticipate mutual aid going forward, like financial reimbursement going forward.
If we go back a couple of slides, I think it's the first one.
Might have been the first slide, actually, right?
So I think it's like 40-something% of our volume is to mutual aid.
Okay,
Like that will work, but
So we got 200 out of 765. So yeah, or not for 20.
yeah.
So yeah, I guess I'm not sure what percent of the cancellations and refusal for mutual aid. So I guess
Some of the larger majority of the cancellations are also mutual aid.
yeah. So we would get
So what would reimbursement look like then? Let's see.
So Bennington Rescue, assigned, has approved from their board for their fiscal year, June to July, 2026, 2027. It's $25 per call that we go to Bennington, and then $15 per call where we're called to Bennington and then get canceled. And then on top of that, we obviously, delegation as well, so that's coming from the service.
$25 is what you'll get back per call?
From Bennington Rescue.
Right, from Bennington. Okay,
That's the same if they come here.
Yeah, so if they come here, so if we go there 10 times and they come to us twice, we'll only bill them for 8.
Right.
Northern Berkshire is still in discussion about theirs. I haven't heard back from them yet. When we had sent a higher amount, it was not approved through their report.
so then you're looking at maybe you have like 9, never mind, okay. That answers the question, that's helpful.
So again, it's not a lot, but it is
Yeah,
something for.
Yeah, I think the overarching sentiment is that we'll leave no stone unturned.
Yeah.
You know, should say that the reality of the situation, you know, what we're asking for and the burden that it provides to the taxpayers is not lost on us, right? We don't make this request as looking at the town of Pownell as a pool of money that we can, you know, just yank stuff out of. It's choices, right? It always is. So we're here, you know, calling the board, you know, to appeal to the taxpayers to make the choice to choose EMS.
Jamie.
Yep.
you have a question? Oh, okay, and I do have, for the moment, one more, and this is just really a simple math question. Right, so basically this net income was about 365,000. Net expenses were 558. The 365 did not include the 150 from Pownell. So if you do include that, it's at 515. And I understand it's not income, but it is money going to the rescue squad. 515 versus 558, and then it looks like a deficit then of 43,000. And I'm sure that that's not. So explain to me why my math is really messed up right here, because I know that's not, you know.
So,
Can you go back to the first slide for me, Hannah, please, before we get?
That is the first slide.
Okay, yeah, sorry.
Yeah.
Okay, this is, yeah, this one here. Thank you.
yes, so, yeah, we would get,
Yeah, so if you added like 150 to the income.
right, so then remember, this is only for 11 months, so add another, would be probably closer to, 600 total on the expenses side by the end of the year. Safe around. So, again, we're looking at a deficit of, $70,000-$80,000 still for 2025. What we know then is that for 2026, we have expenses that are not included in this, like, for example, to respond mutually to New York, we had to add a rider to our insurance policy or a dedicated insurance policy to be able to move through New York and to respond to calls in New York, which I believe added, remember how much that added to the insurance policy?
$6,400.
Yeah, so things like that.
That makes our insurance for 2026 for our maintenance comp, auto, everything $43,000, over $43,000 just for insurance coverage.
So if the rider is like, you said $6,300. So, and I know that you don't know how many calls you're going to get going into New York,
Yeah.
presuming that they are reimbursing you at the same rate, let's just
So
say.
New York is actually a reimbursement, right?
Lower?
But it's more that even like the transfers we take out of SDMC, and 90% of them go to Albany or St. Peter's, even to drive through New York, they have to be covered in the state of New York. So it's not more so the mutual aid, it's us traveling through.
So then is your rider going to cost more, actually, just the insurance? Right, or like the 6,300 more than you're going to gain back by responding to mutual aid calls.
I think we don't have a choice, but to do
Yeah.
mutual aid, it's to
Okay.
sort of like,
And that's fine. I am very pro mutual aid. Don't get me wrong. I'm just trying to understand the numbers here more clearly. Yeah.
So explain to me how come we're obligated mutual aid to different states.
I believe it's a function of our acceptance of Medicare and Medicaid. That we are required to provide as a receiver of state and federal funds, we're required to respond mutually when we're able to do so.
So if we're out on call and something drops for Mass or New York, or even Bennington, if we're not available to do so, then that's classified as it being appropriate. But if we're just sitting at the station not doing anything,
Right.
we have to respond if we're able because we receive those funds.
Any more questions?
Yes, the transfers, those are SCMC or wherever out, they're not home transfers from home to wherever, correct?
Home to the hospital is a 911. The transfers are, to the local nursing homes, to Albany, where people need to get, the tertiary.
Yeah, well, yeah, so maybe from Bennington nursing homes to wherever.
So generally speaking, we wouldn't transfer from like a hospital setting to somebody's house, right? The transfers that we would do would be somebody who's, say, in the ER at SVMC. SVMC doesn't have the capability to treat whatever they need, so they go to Albany or going to Dartmouth, that kind of thing. I think we have done a handful from at the SVMC emergency room to a local nursing home. Those are usually pretty quick. So, I think the overwhelming majority of the transfers that we do are hospital to hospital as opposed to
That's
hospital.
what basically you do hospital to hospital transfers, you do not do hospital to home
Not,
transfers.
not unless it's absolutely like medically necessary, medically covered by insurance. And our 911 coverage is never sacrificed for a transfer. We always have coverage for town while taking the transfer. So 911s in our community and are still covered under 24/7 through 65.
And just for curiosity's sake, the in-town calls, off the top of your head, what percentage are ALS and which percentage are BLS?
I believe 77% are ALS, 911, the 911. 77. 77.
Are ALS.
In the email that you sent to us with the request of the increase of the budget, you broke down some other pieces like the fund for supporting new rig, supporting equipment and all that. I was gonna read that, but I can't open it up tonight. I didn't know if you guys, if you happen to have a copy with you, and you could just that way people out there would know what also parts of what this request is.
And like Paul said, like right now, we're not able to put money aside for that right, because of the way that things are now. Every reserve we have, every donation we have is going towards the general operational necessities.
Right, but if we could, just will help, so people out there will understand also where this number's coming from. That's what I was gonna.
Any more questions?
Yeah, so insurance is obviously already higher than that. If I put 20,000 and it's obviously 43 after I got that stuff back, so that's already at a over 100% increase. But I broke the insurance down, sorry.
Cause you had 20,000 for new rig.
1,000 for insurance. We'd like to put 20,000 into a fund for the new ambulance that we only purchased. Equipment, building.
I think
Know that the I've heard a couple times from the community that they were concerned when we went from, volunteer to paid staff, that was because there was a lack of volunteers and there was no coverage to be able to provide with volunteers. Everyone wants to be paid, we all love to be paid for the time we're putting in, but we're doing this for the sake of the agency and the sake of the community to be able to provide the service that we like provide to.
So-
The service of the community deserves.
So I'm just gonna read this just so people out there will know, like the insurance you said is, you've got better numbers now, so that instead of 20,000.
I dropped down workman's comp, so that's right there.
Right, so it'd be 45,000 between insurance and workman's comp.
Yeah.
The ambulance fund, you'd like to have, be able to put 20,000 forward into that. The equipment fund, another 7,000 into that. The, building and ambulance maintenance, 7,000. Then operating expenses, payroll, insurance.
And that ambulance maintenance as well based on previous, or it's based off of previous years, but not based on having a 2018 ambulance with 100,000 miles on it that's going to start needing repairs.
I just,
Yep.
question will ask a lot of questions.
No, absolutely,
A question on SVMC transfer contract. Is that a contract and then above whatever you transfer, you are paid on?
Yeah, so the way it works is, they pay us, for $600 a day that we do it. It's 8 hours of coverage from 6 o'clock in the evening to 2 o'clock in the morning. We do that 2 days a week. The contract is for a year. Starting in October, it will go through the end of October.
Okay.
So we get the guaranteed income for them, whether they call us or not, we get it. And then when they call, we're able to bill the patient's insurance for.
Okay, that's what I wanted to know.
Yeah. So that would be kind of folded into the insurance.
Mhm.
The SVMC transfer contract, is that January to January, is that how it goes?
The October to October 1st, so September 30th.
Okay. Okay, is that only because that's when you signed it? Do they typically go January to December?
So so in January, we started a pilot program, we did a 6-month pilot program with us and 2 other agencies in the hospital. The pilot ended in July, within 2 weeks, they wanted the contract back up, so by the time we restructured and everything, it was October.
Okay, so that's probably when it would renew again, is October
It's
1st.
SVMC, there is and that's pending that SVMC wants to continue there.
Yeah, we're, I think part of the challenge with it is that we're not the only people that can provide transfer coverage, right? They're the same agencies that could come in and provide BLS coverage like they did in the town of Brunswick, could come up here and do transfers as well. So I mean, that's the risk for us, is that SVMC thinks they can get a better deal from one of its other agencies. That's also part of the negotiation with that, is that better deal or not, your EMS partners are in need of support. And so maybe keeping the money locally is the move. But for the time being, we have that until September. I think the general sense is that it's pretty successful, that it's beneficial to the hospital to have it. It's obviously beneficial to us to do it. And so the hope is that they would choose to renew come October. But I think we'd know more about that in the summer.
I know that we've talked in the past about building a board, and I know that that's not easy. I have had personal experience that I get that. But I'm just wondering, one of the things that I keep thinking about is if you had like a really active, like confident professional board, is potential.
We have found some willing participants.
Great, okay,
It's a small board, but it's a start, and
Okay.
first meeting, we've had a fun.
that's great. Because I keep thinking back, grants are difficult right now anyway. Like we're just currently living in an environment where grants are tough, but I just keep wondering about, there any grants to respond to some of these budget shortfalls, like what the possibility would
So the
be.
problem with grants is they want something specific. One I'm applying for right now wants training equipment specific. And so it's great for, upgrading equipment. There's the FEMA grant will be opening up soon, but you don't hear on that for a year. So
Yeah, no, I get it. That's what I'm thinking of though, actually, is like you're anticipating needing a new ambulance sometime in the not too far future. If you could get a grant for that, that would be pretty amazing.
yeah, so the truck grant only goes, I think, 2% of the AFG grant is
Mhm.
for placement for agencies. That one is difficult, but I did actually, in the last AFP round, apply for a truck and cardiac monitors and we were denied. Finding an operational grant to help us with the operational expenses to offset that is very difficult.
That's generally difficult
Yeah,
anyway, to
that's-
find operational.
What we found context is that generally, if there are operational grants available, they're generally geography limited. So we did find some like in New York, for example. Doesn't do us much good here, right? And again, we've said this, we can forward the report from the legislature if
And
you're
this, and
interested.
then the first 20 pages are a good read about funding in the state of Vermont, reimbursements and just the general state of EMS.
Yeah. And so the problem is that there's just not enough money to go around. And so when if there were to be grants, obviously somebody would need to be willing to expend their money on operational support. And if there's not money to support operations as it is right now, there's not gonna be grants to apply for that.
And something I put added into the appropriation form is the ambulance assessment fee, which this year for us, we have to pay $12,000 to the state. And that's based on, we have to pay a percentage based on income we've received in the state of Vermont, and for this year is $12,000. That's another appropriation.
Buildings and grounds includes heat, am I correct?
So, so I read the numbers right. Your insurance deposits. At 314,000 come from. Your billing partner.
Yeah, so the
Right.
the revenue cycle for it is we will provide the service, transport the patient, we get authorization to bill their insurance. We submit the claim to our billing partner with all the information. They read they read the note, they read what we did, what the level of care was, and submit that claim to their insurance company. The insurance company does their review, and then sends back what they feel is the contractually obligated amount, which again is about 30% markdown from what we bill. So we write off the 30%, collect the 70%. That whole process takes about 90 days.
And people have the conclusion that someone has insurance for getting paid. That's not it at all. People have deductibles, people have, things aren't required, anything necessary, and now insurance companies are starting to even deny 911's insurance to us because they're not medically necessary, or being used as a gap between healthcare or primary care.
So it looks to me like, I did some math there, it looks like your billing partner charges you about 8.5%, right? Somewhere in there, between 8 and 9, give or take, right?
Yeah.
Okay. Well, I think we're probably gonna come back. I don't think we're gonna make a decision tonight, I think we'll come back, so.
Okay.
So I have some more questions if. If everyone else is done.
Mhm.
Do you know what Bennington Rescue receives from the town of Bennington? Do you know what the number is, Beth?
I do.
206,
have it right here.
243, 265.
Fiscal year 26 was 300,352. Fiscal year 25 was 276,610. And fiscal year 24 was 256,875.
So about $25,000 in increases incrementally each year.
Yeah, okay. That's incredibly helpful for me to have that. Thank you. So now I'm gonna get down to some brass tacks, right? Because you did a great presentation. As far as I'm concerned, you've put together some great information. Back, it's a conversation that you and I have had here. What's your sustainability? What is your vision of your sustainability to provide service to the town?
It would be to continue it. And to have the funding available to continue to do it and not continue to have these conversations every month or every year. It'd be the vision to be able to pay my staff at what they're actually working. And at a comparable rate to when not hoping, but Having the fear that they're going to walk out because they're paying at a 20% lower rate and not getting benefits. They could go anywhere. So being able to provide a service, but also being able to provide for the employees that I have at a sustainable rate.
And so Pownell Rescue is a business. We're all in agreement on that, right?
Yeah.
What does your business plan look like? Do you have a documented business plan from the last 5 years to today and the next 5 years? No, there's no business plan whatsoever, right? Okay.
And that is something that is on the list for the board of directors.
Well, I think one thing that frustrates me, I'm gonna be totally honest, because I don't really know a whole bunch of other ways. I don't know any other way. We asked for an attempt to have a board formed a significant amount of time ago. I don't know the exact time, whether it was months or it was a while ago. And there was not a lot of movement from the Pownell Rescue Squad to form a board. Right? I'm not saying that you didn't attempt it, but there was not a lot of movement to form a financial board or a prudential board or whatever board you want to call it. There was not a lot of movement until now. And this is coming from just what I see, right?
So we initially discussed this about 6 months ago.
At least, probably, right? Yeah, whatever. Okay, we'll go with 6. That's fine.
Initially, finding people was difficult, and after our last meeting, I sought out quite a few people, and now just finding the 3 or 4 people that have agreed to be on the board was a struggle.
Don't
So-
doubt it one bit.
So
I'm,
finding the people to, support the board on a volunteer basis, with their family commitments, their job commitments, their.
been there for 40 years, whatever I did it.
So,
Say yes.
so no, the board of directors probably was not formed. It probably should have been formed sooner than it was, but we are moving forward with it, and we do have a group of people who are willing to put in the time to find these grants, to help with these grants, to help fund or to help with education and training and moving the Pownell Rescue forward for the sustainability of the community.
I did a bunch of the math. It looks like your yearly expense is going to be about 600 grand based on the 559. For round numbers, what, for 11 months, add the 50 grand in there
If
for
you
the,
told me it was, if we sat here next year and had that conversation and said it was $600,000, that wouldn't surprise me.
so that's, you know,
Probably a little higher because they gotta pay premiums for next year before.
But
so, you know, round numbers, right? So when we did we had 366 in income, 150,000 from the town in income. There was 45,000 from SDMC income, which brings that, and I'm not gonna count donations because that's such a fluid thing. You could get somebody that leaves you 50 grand or somebody leaves $5.
Yeah.
Okay, so that's totally off the table as far as I'm concerned as income, and I want to be perfectly clear there because you just can't go anywhere with that, right? No, you don't know. It's, somebody could leave you $1 million, no, right? Could happen. So that puts you at about 561. It puts you, 561. So just doing some math.
yeah, I mean, best case scenario, we're still short next year.
No, I get that part.
Um,
I think where I'm coming from is $150,000 increase, 100% increase is a huge pill to swallow.
Absolutely.
Okay, we all pay taxes. We're facing a 12%. And it just totally irrelevant to you guys. I mean, this is totally, we're facing a 12% increase from education tax from the state. It's now, I want people to know, you guys, I hope you're aware of this. I'm not sure if you are or not. We have sent out invitations to our legislators and senators from our area to have a meeting because I, for one, have had enough of that kind of increase. Okay, same as everybody else that pays taxes in town, or any town for that matter. I don't care if you live here or Bennington, right? Still paying that 12% more. So, I think your presentation has been incredibly thorough. I don't know if the board's ready to make any kind of decision on this. I for one am not.
I am not.
Yeah,
And I think you guys anticipated that by the last slide. I saw the very bottom of the last slide, right? So.
Yeah.
Could you just state your name for us, please? Sorry. Sure.
Guys, it's not hearing about this to add that, these numbers that we're looking at, that is including all the background volunteers. I'm sure that's going to be forward. Here, so if we look at our numbers for the end of the year, ideally it would be higher, right? Because we get paid people for the time they work. So just to remember that, and maybe looking at it now, why don't we get there's $50,000, we're only 50,000 short, but at the end of the day, it's also trying to provide livable wages to people and pay them for this.
I absolutely understand that 100%. Okay. I totally get that part. All right. I volunteered in the fire service from the forever. So I totally understand the volunteer part of it. No, I know. No, I get it. And I think everyone sitting at the board gets it. I think we all understand. I think we all understand. Every one of us sitting here understands. And I know that everybody on the rescue squad understands this too. We have a responsibility to the
I was
taxpayers.
just gonna say,
We have a responsibility to our emergency services. Okay, so we have to balance this out as to the best that we can. Okay, look at what I love to sit here and not have this conversation. Would I love to sit here and write a check to the Pownell Rescue Squad for an extra 150 grand? 100%, absolutely. Every one of us would. Okay. And I want to be crystal clear on that. Is it something that we really need to look at, no matter what it is? Absolutely. We have to scrutinize this and we have to do our part.
So, we, along with every other interested party, the highway department, everybody, we make requests, you make decisions, right? That's the way it works. And this is the request. And, like I said, we certainly didn't anticipate a decision on this tonight. And what we want and what we hope for is a continued ongoing partnership with this board, with the taxpayers of this community, to make sure that what we can provide is 24/7, 365 professional EMS coverage at the best possible price we can. And that's kind of the bottom line of all of this presentation, is that we do, right? And we do it by volunteering our time because we care about the agency, we care about the taxpayers. To Kelly's point, we would love to, everybody would love to be paid the highest that they could, right? Ask anybody you want.
Me too.
Raise, right?
I'd love to have double what I get every month too.
It's all made against the backdrop of every other request that is going to come before the board this budget season. You weigh them and you make your choices, right? And the goal of this was to start by.
You gotta start somewhere.
We gotta start somewhere.
Gotta start
Hope that we can
I get it.
demonstrate to this board and to the taxpayers that if we do nothing in the future, there is going to be a reality that does not include the Pownell Rescue Squad.
That will cost far more with far worse, not far worse care, but longer times waiting for an ambulance. Look at all the time we're responding mutually to other communities. That's more time that they're not gonna have to respond to this community. And they're not gonna do it for free, because at that point, it's not mutual aid for them, it's primary.
Yeah, and so we want this board.
I understand that 100%. I think everyone here
And we've
does.
tried to inform the community of that with our informational sessions, so.
I guess that's the request, is to weigh this against the backdrop of everything else that you might have to weigh this budget season and think about what the priority is for this board, and what the priority is for the taxpayer, and figure out if that includes Pownell Rescue Squad in 2027.
And our general hope would be that things change with legislation and rates increase, and then we can decrease our requests. I mean, obviously, that would be our hope. I'm a taxpayer. I'm not trying to make this worse for anybody, but the reality of it is to have
Right, no, and like I said, I mean, I think your presentation was really incredibly thorough and it's given us a lot of information to chew on and sleep on and regurgitate and.
Like I said, I'm sure this is not the last time we'll talk about this.
I'm sure.
I hope it isn't.
No, I doubt if it will be, the last time that we do discuss it, so. Any board members have any more questions?
No, no.
Do you guys have anything else that you wanna present or? Okay, it was a great presentation and it's very informative for sure, so.
Well, thank you all very much.
Thank you very much for coming very much.
Fiscal year 27 road fund budget draft discussion.
Thank you, Becky.
Good night.
Ellen came because it's a budget discussion meeting.
Anybody have any questions for Ellen on the road budget?
Questions, comments,
Nope.
anything for road?
Nope.
Read it, went over it, we had that conversation.
I looked at the road budget pretty extensively, and I think it's a pretty solid budget. That's not, I don't think there's a lot of, I don't think there's a bunch of fat on the road budget.
I don't know.
I think it's pretty lean, honestly, I think it's a pretty good, I like the, we talked about it last time. I like the wage, format for a potential new employee in July. I like that idea. Gives us a chance to maybe, draw from a larger pool of prospective employees. So, if nobody has anything on the road budget, we'll move right into the general. Everybody's good with the road.
I'm good with the road.
General fund budget, draft discussion.
So I just made the changes that we discussed at the last meeting. We changed zoning expense line from 300 to 600. And we created, we as in Ellen and I, created a conservation commission expense line and we put 500 in it as state. Reasonable. We looked for spots to cut so that we could increase the sheriff's contracted hours, but that wasn't really, that was pretty tough, fine. The only place we could really cut is wages, so I had to run numbers for a 3% increase instead of a 5%. And it's really about $5,500 difference, it's not a huge,
Between a 3 and a 5.
yes.
Okay.
$5,500, it's,
And that's including the fact that municipal retirement are of that.
Okay.
right, all of the payroll.
Decreasing that also.
So if we did that, just so that I'm clear, because I think if I remember right, my math was correct. If we increase the sheriff's department from 25 to 28 hours per week, it was about a $13,000 increase per year.
That's what you said, yeah, I
Yeah.
double checked.
Yeah, right. No, I'm pretty sure my numbers are right. It was fairly simple and my calculator on my phone was
Yeah.
helping me a lot. Didn't have to rely on myself. So just so the, doing a number, right? If we took that 5,500, it would be about an $8,000 increase if we increased the sheriff's department. If we went from a 3% or a 5% down to a 3%. I'm not comfortable with doing that, but those were parts of the discussion that we had at the last session. I'm not really comfortable going with just the 3% pay increase.
I'm not either with everything that's evolving and
So,
everything.
Yeah, I would prefer to keep the 5% increases. But something that I am still open to looking at, I think we should look at. Hannah, I was able to look at the basically the logs from the sheriff's department, and I definitely appreciate the work that they do here. And it's really hard to tell, like when you're looking at a log, like how much time someone is spending and what it's taking. So I don't know that necessarily gives us it's helpful, but a good handle on time, like how much time is being spent. And I guess one of the things I keep coming back to, I mean, $13,000, I mean, that does matter in this budget. And I am not seeing, do we feel like that there's a necessary increase in time being spent here because I'm not seeing that. I'm not sure if the sheriff's department is reporting to us, or I'm not hearing this from residents that there's always the general, oh, we want more police, like 24/7. Okay, fine. But that's not the reality here. Like, is there an actual need to increase the time and increase our budget by $13,000 to have additional hours in the sheriff's department? Are their needs not being met?
Well, I don't want to say that, and I didn't bring that up because of anything other than, we hear both sides, right? We hear we need more police coverage. We hear we don't need more police coverage. We hear both sides of it. So I just wanted to throw that out there, that
Yeah.
this is what, 3 hours, and I don't know why I picked 3 hours. I just randomly came up with 3 hours because I had to have somewhere to start, right? So that's what 3 hours was gonna cost extra for a year.
But I think that's helpful, right? I think that demonstration, that's really helpful. Because you can think about, oh, okay, 3 hours,
But it's not 3 hours.
right?
It's 3 hours times 52.
That's what I'm saying. But if you just think about it, I think that's the question. If I think about 3 extra hours for the coverage per week, and at the end of the year, that's gonna come out to $13,000. Do we have $13,000 worth of additional?
And also remember that the sheriff department's contract specifically states that they're not a 911 service.
Right, exactly. I guess what I'm trying to say is I don't see the need to increase the amount or the coverage hours with the contract.
No, I don't see so. I think unless there's a specific need, and I don't see it.
And I'm fine with it. I just brought it up because that's
Yeah.
things we hear, right? We hear that from our constituents.
Mhm.
And, amongst other things, right? And, I know that you can bet that we're gonna hear. And that's one reason I didn't want to have any action on the rescue squad tonight, to be honest with you, because we're going to hear
Oh,
the
yeah,
pros and cons. And I want to give people the opportunity,
I think we already are.
right?
Yeah.
Yeah, so,
Do you have a comment on the rescue squad piece? I know you wanted to comment, and I know you don't feel well, so how about you come say what you want to say so you can leave?
well, are we good? Are we good with the general budget?
Yeah.
I'm fine not adding the sheriff. I just, so we can move
Yeah.
on. So,
Status quo.
that's right.
So I think we obviously can't approve a budget tonight.
Right.
But as far as the board is concerned, the budget looks good, except for the rescue squad piece is what we need to figure out.
Correct.
Okay.
And just so reminder, there might be another.
Ballot article.
Another ballot article adding to the, which we have no control over if somebody's asking for money and submits a ballot article. So if that changes, we'll obviously give you an updated one. With the rescue squad, the only thing, for a couple of things while I was listening to them talk, because at first I was like, because I was like, oh my God, 300,000. First of all, they did immediately, after you had your meeting, they came in here and saw me to start a board. They did ask me to be on the board. I decided, I said if someone else that they were looking for was on there, that I would be on it. And then today I decided not to be on it because it's kind of a conflict
I wonder, yeah.
of interest because I'm treasurer.
Mhm.
And so doing the budget and then trying to do that stuff, I will help them on the offside. But now I can't do that in this, so I did notify Becky today that I could not do that, just to let you know. But I want you to know that they really have been working on trying, it's really hard to find.
I'm sure.
I really do know honest that they have been trying, they reached out to me. Asking if I knew anybody that had just time and knowledge to give to them, to help them offset some of the other decisions and help them. 300,000 is a lot.
Big ass.
It's a big ask. And the future not having a rescue squad here is worse.
Yes.
Because anybody that's lived it, not having people on call, so this is more for us and the general public. The call times and et cetera are so important when there's emergencies, so it's a kind of a catch-22.
It's a tough, this is the tough,
It's a tough one.
we're in a tough spot.
It's a catch-22. I know they've done a lot of their donations their donations or their fundraising, what they've tried to do and sent out letters to the townspeople asking for donations. People think that $25 or $50 doesn't help, but it really does help them.
Yeah.
It adds up. So when people just say, oh, well, my $25, because that's all I have, wouldn't help, it really would have. And still could. But yeah, it's a tough number. So
It's just, we have to really,
it would be really. I do know that I've looked into some other, it's very expensive to have, because we have to have something.
Yeah, because it falls back on us
It would fall. back on
to
us.
contract with somebody to come in and do it.
So that's.
So probably we're talking more money than what we're spending right now.
well, I think,
A
so,
lot more money.
so I think what we need to do, okay, because there's multiple opinions on where that happens and what happens if there wasn't one, right? Okay,
Mhm.
so I think we need to reach out to the LCT. And we need to get a definitive answer. I know that I tried to look this up and I couldn't figure it out to save my thought. I think we need to reach out to the LCT. We need to say what,
Our obligations.
that's right, and then go from there. And then, so, not, because if we're not obligated, that's not what I'm saying either. I don't want to be that person. But
But if we have an
if
obligation.
we have the obligation, then we know what's gonna be cheaper.
Mhm.
Yes,
Okay, so I just want to make sure we understand and we have accurate information, Carl.
yes. I
So
agree.
I have no other changes. We have no changes to do
Nope.
at this time.
Nope.
If there is, you guys, we have time to keep reviewing, so don't be
Yes.
afraid to keep reviewing and let's.
I think they're pretty solid budgets.
Sit down in the morning and, we can pop anything in.
I think they're pretty solid. I'm pretty happy with both the road and the general fund, so I am. I think we all are.
Mhm.
Question, as long as we're just talking about the rescue squad. And to your point, like, do you have a business model? Like your business, but is there a business plan? Is there a business model that you're following that does work, that is successful? And I absolutely heard them at the beginning of the presentation saying this is a problem everywhere. It's not
It
just a
is.
panel issue. This doesn't work. It's not working anywhere. So do we know, are there any surrounding towns that have a rescue squad that operate as a business that it is working for them financially?
No, even Bennington, it's really not. And
That's what I don't understand when you look at Bennington's rescue budget, they run at a deficit every year too. And I don't know what they do to cover the shortfall year to year.
That's what I want to find out about. That's why, because we're looking at increments increasing each year, get it? But you're looking at 25,000
Right,
versus,
and their grants and donations fluctuate.
100% increase.
But that's because for years, they asked for 50. So understand, for years, they were 50,000, where Bennington was
for Bennington.
200,000.
Right.
And then working their way up.
Right.
Powell was 50,000 per
You
year.
won't see it.
Okay.
And the ballot article, 4 years at 50.
Forever.
Until last year.
Up until last year. Then it went to the 150, so for years,
okay,
Powell only asked for 50.
that's helpful. Thank you. I didn't,
Yeah.
that's very.
I know you didn't know that. So that's the difference, so they do have, so that's Bennington or other areas that get money. Most likely, we're getting way more than the 50.
Plus possible endowments and whatnot.
Yeah.
And it's sad.
We're
Yeah, there's
over
others.
the years and, but, that's the same as a donation, it's not a guarantee.
As far as the municipal responsibility piece of it, that is important to know.
Yeah.
And
100%.
again, how are other towns doing it with that shortfall? Because the towns aren't covering the entire shortfall, so there
Because I
must
do
be a
hear
way
their
there.
calls, because I'm on the fire service.
Right.
manager, So their calls come over mine, and they do go to Williamstown and Bennington a lot, Petersburg. And that's a Grafton,
Yeah,
and then, and this is knowing, dispatch knowing that it's gonna take them a half an hour, 45 minutes to get to where they need to go.
Yeah.
And canceling them halfway. So that's, their gas and then and
Yeah.
wear and tear, and then they go back. Instead of the station rate, the next call, so.
That's kind of my feeling as far as the contract with Bennington is like, it's not even covering the fuel.
It's, but it's better than zero.
No, it's better.
25 is better than nothing.
I know it's better than
We've been getting it
zero.
Forever.
I know.
So,
And that's why I,
Zero is zero.
Zero is zero. 25 is 25, but it's 25 more than zero, so.
I agree with that. I'm just,
Still 25 better than zero, so.
correct.
Exactly.
Okay,
That's all I have to say.
Thank you.
I just want you to know they really have been working.
Yeah. It's hard to get aboard. It's hard.
It's-
I totally
it is very
understand.
hard.
nobody wants to get involved in anything.
Well, I mean, it's just a thing. I think we're all, yeah.
And it's time, a lot of it's time, or conflicts, or
Yeah.
people that are already on boards. You can only be on so many boards, and then you have no more time to be on one more board.
Yes.
Really?
You've been talking to my family.
Really?
I totally, I mean, and I agree, definitely we need a rescue squad. I just wanna, I'm trying to figure out the finances of this too. I'll get it here.
Well, I think we all are.
Right.
We all, are, for sure. Thank you, Alan.
Thanks.
Any board members have anything else?
No, I'm good.
And do we have any public comment?
Yeah, I saw something.
Just to bring that chat out here.
Yeah.
Oh, let's just see if there's any hands.
Take care.
No hands up?
Just chatting away amongst themselves
I
and
make a motion
No.
that we, we're done.
Adjourn.
Adjourn, there we go.
All those in favor? Aye. Thank you, everyone.
Thank you very much.